Welcome to the Questions and Possibilities podcast. I'm Dr. Terry Hope, and I invite you to join us for dynamic conversations with powerful changemakers, visionaries, leaders, and brilliant creators from around the globe. These unique and powerful conversations are a place to explore the voices of possibility and creation of future, wondrous curiosities of those seeking and choosing to create a greater world. Good morning and welcome everybody to Questions and Possibilities. And I'm here today with the miraculous Steve Feldman. And thank you, Steve, for joining me. It's really such a pleasure to connect with you again.
Yeah, well, I'm happy to be here, and thank you for having me on.
Cool. I wanted to share with people a little bit about like the history of where you work and why you work there, and the company that you're affiliated with, which is so miraculously brilliant. And I really think it's brilliant because it takes into consideration whole person care. So tell me a little bit about, so you're with Feinberg Consulting, which is completely different than almost any other trajectory in your field, correct?
Yeah, I mean, our company is certainly unique, and I'll give you a little history and input on what we do and how we do it, and most importantly, why we do it.
Fantastic. Let's
Yeah,
start there.
So the company was established in 1996 by my partner, Pam Feinberg, who is a nurse. And initially, the company focused on providing care coordination and advocacy for people who have been catastrophically injured in auto. So a lot of spinal cord injury and a lot of traumatic brain injury clients where people really weren't able to coordinate their own care, advocate for themselves. And Pam began a trajectory of helping those people. In Michigan, there's a particular carve out of the auto no fault law that case management was a paid for benefit, and the people having an accident received lifetime benefits.
Wow.
And in this field of being able to help advocate, Pam built a unbelievable reputation of providing work that was of the highest integrity, the highest creativity, and being able to look at things in a way that wasn't, well, this is how this is done, or how this is treated. You know, this ability to collaborate and use the collective knowledge of others, of experts, and the ability to communicate in a way of really what's possible in something that maybe otherwise wasn't seen. And the company really took off and grew in an amazing way, and over the years have really helped thousands of people who have been impacted by by an auto accident.
And you do auto critical placement, but you're also involved in other aspects of care, correct?
So yes, and one of the things that Pam recognized early on, and is where I came aboard into the company, is that there were other areas that could use this same type of skill set of coordination and advocacy and really coaching in other places. And those other places included people that were struggling with some type of addiction or behavioral issue, whether it was some mental health condition. And what we really created was a part of the company that helped families and individuals navigate through the challenges of behavioral health issues, as well as other complex medical. And you know, you stated, Terry, before that one of the things that Feinberg is a unique company. We're unique in the fact that we have a behavioral health team and a medical team. And as consultants, case managers, coordinators of care, to be able to look at everything that we do through the lens of medical and behavioral health puts us in a place that's pretty unique. There's really not other companies that are doing that. We recognize in so many cases when there's a complex medical issue, there always is a mental health component. And in many cases, there's a mental health or an addiction component with a complex medical issue that is also there. And to be able to see and treat all of it, to be able to recognize what's maybe the biggest priority is super important. And the other part is really being able to help support families, because in many cases, families don't know how to best support their loved one. Their intentions are the best, but maybe the delivery could use some help. And how we know that is in many cases, the results that have happened in the past haven't necessarily been stellar.
And what I think is interesting is that the work you do isn't end care. You're kind of like the heat-seeking missile of what's going to be the best solution. Did I get that correct?
You know, a great way to look at this in the story is that we are the guides, that our clients are the heroes, and the villain, if you would, could be the condition or the diagnosis or the current situation. And we are the guides to help the heroes overcome the villain. So go ahead.
So you don't do end care, I guess is my question.
That is correct. Our direct impact is being able to help families and individuals navigate through what they're experiencing by assessing and really being thorough in that assessment process, to be able to come up with recommendations and strategies of how to address what's going on. Mm-hmm. And those recommendations may be the type of care, the level of care, the specific providers, which we spend lots of time, effort, and resources to understand what's available all over the country and really all over the world, to be able to make the most appropriate recommendations, and then strategies on how do we implement these plans, because sometimes people aren't necessarily raising their hand excited about what the recommendation is. And our focus is mostly about how do we get to the goal that the family and or individual is really trying to accomplish, and how do we do it in a dignified way, in a loving way, and in a supportive way.
Mm-hmm. And so it's funny because how would people, if I knew, and I do have clients who have like addiction issues, let's say, or substance use issues. Why would they require this is going to sound like a funny question, but why would they require your services? Because there's a sea of, in fact, I was looking at the financial demographics, and it goes everywhere from $6 billion to $36 billion industry currently, and growing substantially, like that addiction care side. So how is it that people would go, here, I require somebody to advocate for me or to navigate this? What's the gap there?
It's a really great question. And one of the things that is really important to know is that our services are a private pay service. Mm-hmm. So the work that we do is not able to be paid for or reimbursed by commercial health insurance, mm-hmm. or medical insurance. Mm-hmm. But really, the answer to your question is, in looking at anything, when anybody achieves anything great in this life, if we put a spotlight on it and look closely, they have incredible counsel, guidance, coaching along the way. Yeah. And people are not trained in knowing how to discern between what is needed, what's good, what's bad, what's called for. So consultation with somebody who is experienced in the area, somebody who has done this before, this is an opportunity to not have to learn for the next time, because people are not looking for the next time. So there is a really type of person or family that is used to bringing on people to help accomplish something. You know, whether it could be landscaping or remodeling a kitchen, and it could be something with a business transaction that requires a lawyer or a business consultant. This is no different.
Yeah. And I imagine with the sea of options that are out there, and even like just end care places, to navigate really, if it's a good fit, would be very difficult for the average person who doesn't even know what to ask and what is the missing piece of information.
100%. And especially if I am speaking to that provider whose job it really is to acquire clients, they may not be as neutral as somebody that is really representing the family or the individual.
And that's a really cool approach, because it keeps your specialty and expertise of being able to discern what the client really requires, a family really require, and to weed through the known and unknown is such a gift for people who don't know how to navigate it. Like, it would be a fantastic gift.
Yeah, absolutely. And that is something, and we talk about this all the time, we take that responsibility very seriously, because what most people in today's age do to gather information is to get on their computer, get on the internet, and search something. And although there is really great information available on the internet, there also is a lot of information that is not real, that is not accurate, and that worse may not be ethical.
Wow.
And what we really work very hard to do is to learn about the programs and the people that we refer to. And whether it's visiting ourselves and being able to actually tour a facility or a program or an office, or in today's day and age, we've been able to meet many more people virtually. And we also have a very strong network of close people that we know in this industry that we can also rely on for getting the most up-to-date information about particular providers.
Wow. And I think you mentioned this to me, but just for people to know, so you actually get hired like a lawyer would by the client, and you don't have any end gain for who you send the person to. Is that correct?
That is correct. That is correct.
So it's completely unbiased in terms
100%.
of approach.
That's right.
Which means that you really are looking after the person or the family's best needs and interests.
The way that we talk about it with families is that we want to come sit alongside of you to be able to navigate through this together. The combination of the family and the individual's knowledge of themselves or each other and a lifetime of experience, and then the knowledge that we have specific to this field and this industry, the combination of those two can put together a real strong plan. Because we don't come in to dictate. There's not one way to do things. And what's so important, especially in the way that the system works today, that this is very relational. This is not transactional. And most of the time when you speak to somebody who has had some significant healthcare crisis or behavioral health issue, when they talk about providers, most of the time it's spoke of as more of a transactional thing.
Yeah. Yeah. So it's kind of interesting because you keep on mentioning family, and I guess that's in a place where the person isn't in the place where they can actually advocate for themselves quite as much, or it can be sometimes when it comes to mental wellness, the inability for, like, the family needs to step in. And I'm wondering, when it comes to that kind of thing, do you ever get it so that family members, like, how do you deal with family members because families are so diverse, right? How do you deal with when family members don't actually completely agree on where to go? Do you come across that?
Sure. Absolutely. There are a lot of times that when you talk about the family needing to step in,
Mm-hmm.
and the word intervention is thrown around quite a bit.
Mm-hmm.
And for me, intervention is an interruption of something that's happening that's not working.
Mm-hmm.
Intervention doesn't necessarily mean it has to be some surprise where somebody walks into a group of people sitting there. But in the event that it does, because the only way that you may get at somebody who needs to be able to be redirected, let's say,
Yeah.
it's a process that we take very seriously, and we work with families very closely on how to align and get onto the same page of what needs to happen to be able to get that help. See, what happens in many cases, you ask the question about families when they don't agree, is families have history and there's emotion. So when history and emotion are present, it is grounds for disagreement, let's say, or dysfunction. What we can do is we help families agree on or align with what it is they want to accomplish. And in many cases, it's to help their loved one get out of danger, to be able to recover from what they're experiencing, and move into a path of living some kind of dignified, joyful, meaningful life.
Yeah.
And we can agree on the highest place, then we can also agree on a way of getting there. Like, what are the things that are going to be supportive to make that happen? So, for instance, if it's agreed upon that we want to help so-and-so get to treatment, right? What kind of way of being is going to be important to do that? And a lot of times it's patient, it's direct, it's loving. And if we agree that those are the qualities that are important, we can help families see if anger, resentment, rage, poor communication might get in the way. So we can help families see that if they want to accomplish this, these are the things that support it.
Mm-hmm.
So we don't have to agree on everything that's ever happened in the past. We just have to agree and align on things for this matter, and try to put everything else in the parking lot. And
Yeah.
it takes a skilled professional to help navigate through this place.
Yeah. And that's brilliant. It's brilliant, because what you're saying really is, we're not going to tell you how to do it, but what we are going to show you is, what I'm hearing is, we're going to show you the things to stay focused on so that it actually directs to the target.
Yeah, we use the analogy all the time of the environment versus what we're growing in the environment.
But
All right, so here in Michigan in the wintertime, if I want to grow a cactus, it ain't happening.
Yeah.
No matter how hard. There's a certain environment that it takes.
So do you find that in the work that you do, and working with families and loved ones who are connected to this, do you find that over time they start to get better skills with living? I'm just gonna say.
Yeah, part of our offerings are being able to provide coaching for families.
Wow.
And most of the time, there is a focus on education, because education creates knowledge, and with knowledge comes the ability to make better choices.
Mm-hmm.
And then the biggest focus is on self-care. and how to look at taking care of yourself so that you're in a position to be there for others. It's the whole adage of what happens when you get on a plane and they come on and say, put your oxygen mask on first before helping others. And that focus on helping families fill up their tank is so important, because in many cases, when families come to us, they are all so focused and empty, and in many cases feeling broken, because all the energy is on trying to fix something or somebody else, and they're doing it with nothing in their tank.
Mm-hmm. Yeah,
And
kind of that exhausted, I've done everything, and frustrated, and which would escalate any emotional components that would be there.
100%.
That's not a recipe for success, leaving it in that way. And so do you find that people start to really evolve their own way with that other service that you provide?
Absolutely. There is amazing stories and amazing gratitude that families have for the insight that they gain and the support that they get and the tools really to move in a trajectory of their own growth.
Mm-hmm. Wow. So I'm curious about like kind of sector. So do you come across areas where it's like acute scenarios where someone who's just had an auto accident, they require acute care, and also those who have been, it's like the long-standing chronic thing that all of a sudden starts to escalate into something else? Do you tend to focus on one thing versus the other?
Not necessarily focus. We're able to help and come in at wherever somebody is or a family is on the continuum, beyond very acute to an ongoing chronic situation.
Wow.
The truth is that most of the calls come in out of some sort of crisis, right? People usually take bigger steps when the pain is greater.
I've always wondered why that is, that people wait, all of us in general, wait until it's so intense that we actually go, now I have to do something about it.
Yeah. If we were to interview everybody that we've ever helped, the probably biggest feedback that we get is, I wish I would have called you sooner, or I wish I would have known about you sooner.
Mm-hmm.
And frankly, and I think you and I have talked about this before, is our biggest challenge is being able to help people understand that this type of service is really available.
Yeah. And I imagine that because you help people navigate best care scenarios for whatever is there, that it actually has a cost benefit ratio, because it's not like, here, I'm going to try this place for 2 months and then find out it's not a good fit, and then try to create something just more like it creates a level of disruption, right?
So it's a great point. And the other part is that in the lens of the fact that recovery is a lifelong situation,
Mm-hmm.
that when it's managed, there is less of a chance of recurrence.
Mm-hmm.
And the acute relapse or recurrence that happens also, when you talk about cost, is an escalator of cost.
Mm-hmm. Sure. What is the percentage of, and I don't even know this, the percentage of relapse in an average scenario? Do you have that as a number?
So it's an interesting question, because it depends exactly what you're measuring.
Oh, okay.
And it depends who's measuring it.
Oh, of course, always.
What we know is that the success rate is much better when there is accountability and there's purpose.
Oh.
And how we know that is, and the one percentage that I will quote, and I'm sure I'll be very close, is the doctor and pilot program, the professionals program, that requires 5 years of reporting of support in order for them to be able to keep their license, has something like an 83% complete abstinence over a 5-year period. And that is because there of the accountability over that period of time, and that desire to be able to continue to do what they want to do, what they love to do, or where they gain meaning.
Mm-hmm. Yeah. So
Heard that the without it, it's flipped the other way.
yes, I can see that absolutely. So do you find that, like, so you talk about like people make these choices when they get to a place of crisis. Is there a way that people could, out in the public, know more about the kind, like get there early, like early stage, let's, move this along faster? I was just talking to somebody the other day, and they had an 8-gram a day cocaine addiction up until 2 years ago, and they lost over 20 years. And they lost their kids and so many other things about their lives. And that in itself has a cost, not only financially a cost, but is there a way that we can get to people earlier stage before it becomes crisis? Have you come across some way that people can know that, like, hey, pay attention?
Yeah, that's a very big issue, and a really important one. And a couple of things that occur to me when you say it is that one of the features of addiction, mental health issues, family dysfunction is denial. And that denial is, it's going to get better, I'll deal with it tomorrow, or even the stigma around bringing anything up, like I can handle this myself.
Mm-hmm.
And for me, the ability for people to be in touch with what's really happening happens through a therapeutic, a relationship with a therapist, a relationship with a coach, a relationship with people that there is open, honest communication with, to be able to get it out, to be able to talk about it. Because from getting it out in the open, it's not hidden. And dysfunction, addiction, disease wants to hide in the shadows.
For sure.
So it's a big point that you bring up. And really, for me, it is about being able to talk about it and not waiting.
Yeah. Yeah. And it's interesting because, statistically, when you look at people with mental unwellness, we'll call it, like anxiety and depression, even just like early on stages, a lot of people don't go for help. And the biggest statistic is because of the stigma attached to it's a mental disease, as though they're at fault for it or shamed for it. And you look at the numbers, and that's like one of the biggest pieces for it in the developed countries.
Absolutely.
Yeah.
Absolutely the truth. And, we try to talk about this all the time. This is not a weakness, a moral failure in any way. This is a treatable and important thing to be addressed, and not pushed away.
No, and for me, I look at it and go, any amount of time that we live here and we're unable to live with happiness or to our fullest capacity is sort of, it's somewhat a loss to what the possibilities could be. And I know that when I've spoken to you about how successful the work that you have done for people to actually move forward and so that they can get on their lives is really remarkable.
Yeah. Yeah. I mean, the people in our company that are involved in this work, myself included, are doing this out of that passion to wanting to help others
Mm-hmm.
You know, for me, I have my own story. I'm somebody who's in long-term recovery and was at a point in my life where I did not think that joy, that lightness, that fun, that health was ever going to be part of it. And I have accessed that in many parts of my life, and I'm so grateful for it. And I think I'm wired in a way that I want to share it with others. And I work with a whole bunch of people that are in that place. So this is passion driven, mission driven. You know, it is a business, right? We have a payroll to make every couple of weeks. But the truth was, the people that we're involved with didn't go down a list saying, here's the most profitable place to be.
Yes,
This
of
is
course.
this is out of everybody that's part of our company has some connection to the meaning of being able to help others.
That's fantastic. Which makes you really understand care.
Yeah. Yeah. Yesterday, I received an email with somebody that we had worked with for almost 2 years who was sending an email of, ending services. And we went from this woman's husband was recently retired and ended up drinking excessively, and he couldn't stop, and he didn't admit having an issue. So we put together a group of people and came in and helped him say yes to getting some treatment. And he's been sober ever since. And his wife has been participating, the woman who wrote me, in coaching and doing a lot of her own things, involved in Al-Anon meetings and other support groups. And she wrote and said, I can never thank you enough. My husband is doing great. You've changed our lives. And this was the greatest referral I could have ever gotten. So thank you.
Uh-huh.
And those emails and those contacts are the things that make what we do so worthwhile.
Wow, that's fantastic. Is there anything that you would like to share with people that we haven't yet covered that springs to mind, that if they came across this, they might go,
You know, we talked about it and we just touched it here recently. And this is a question that I've been asked before. And what comes to mind every time is don't wait. Don't wait. You know, you've talked about and told me about listening to those little voices during quiet time. We know many times that it's time to take action on something that might be uncomfortable. And by avoiding it and waiting, it only gets more uncomfortable. Reach out and get help whatever that looks like. Keeping it to ourselves continues to promote the issue to grow.
That's true. So thank you. Thank you so much for taking time out of your day. And thank you, everybody, for joining. Such a pleasure to talk with you. And I wonder what you could innovate next so people would be able to get there sooner. Thanks, everybody.